Hi, my name is McDonald, and I will be going over patient education for acute bronchitis, a persistent cough, and nasal congestion, along with the different medications that are going to be used to treat these. So a little bit of background on acute bronchitis. What is it? It is a contagious viral infection that inflames the bronchial tubes. And so what the bronchial tubes are the tubes that allow the oxygen to go down into your lungs. And so basically when these get inflamed, it makes it harder for you to breathe because it narrows the passageway along with the mucus buildup that goes along with it. So some symptoms of acute bronchitis are chest congestion or tightness, a sore throat, wheezing, fever, chills, and body aches. So the treatment for this is you want to replenish your fluids, but stay away from caffeine and alcohol. Rest, increase the humidity in your home, or you can use a humidifier. And the medications used to treat this are acetaminophen or Tylenol, and then ibuprofen. So now we're going to move into persistent cough. A persistent cough is the expulsion of mucus, microbes, and foreign particles from the respiratory tract. Some common causes for this are a postnasal drip or mucus running down the back of your throat. There's asthma, GERD, and chronic bronchitis. So the medications used to treat this, you have several different options. You can use antihistamines, things like Zyrtec, inhaled asthma drugs such as albuterol. There's antibiotics if there's any type of bacterial infection going on. There's acid blockers if you have GERD, or there's just your basic cough suppressant like you see in your picture. So now moving on to nasal congestion. Basically what that is when your nose becomes stuffed up or inflamed. Some common causes of this are a cold, the flu, sinus infections, allergies, or a deviated septum. And some medications for these kind of overlap with the last one, which are antihistamines, so things like Zyrtec that you see in the picture. There's nasal sprays. There's antibiotics if you have a sinus infection or any kind of over-the-counter decongestants like the Mucinex D, for example. And here are my references.